Um, Excuse me, I'm Chinese interpreter. Where's my channel?
I will assign you now.
Okay, thank you.
Good evening, everyone. Thank you for joining today's session. My name is Christina Austin. I am the Field Operations Director for the Child Care Licensing Division. My role is to lead our statewide licensing teams and to bring a strategic lens to quality and safety in childcare. It's so wonderful to be here with you today, and we truly hope you find this information useful and supportive as we navigate these rule revisions together. This presentation is a summary of key changes to the Registered Family Childcare Rules, which will go into effect on July 1st, 2025. We will not be covering any rules that did not change during this rule revision. Please note this is an overview of the main updates, but it does not cover every single change in the new rule set. Our goal today is to give you a clear understanding of the most significant updates that will affect your childcare program. We want to make sure everyone knows how to access interpretation services if needed. If you require interpretation in another language, simply click the globe icon. It looks like a small globe, and you'll find it in the bottom right corner of your Zoom screen. Once you click it, select your preferred language from the list, and the interpretation will begin immediately. If you have any trouble accessing interpretation, please let us know through the Q&A tab, and we'll do our best to assist you.
haddaad u baahantiid daryeel fadlan Q&A-ga taabo ama su'aalo
Before we dive into today's content, I'd like to take just a moment to go over a few housekeeping items to help the session run smoothly.
intaanan
First,
u gelin
please
kulanka
note that the chat
waxaan rabaa
function
inaan
has been
kulanka
disabled
qaabka
for this webinar.
aan u
If
kulmayno
you have any questions
maadaama
during the
shaashada aan ka
presentation,
hadlayno
we ask that you
haddaad
use the
su'aal
Q&A
qabto
tab
waxaan
located at
doonaynaa
the bottom of your
inaad
screen.
inaad
We'll do our best to address
su'aal
as
qabto
many
inaadan
questions as
joojin
possible
hadalka
during this
sidaad
session.
su-aashaada u weydiisid
That being said, please
doonayna inaad soo
understand that we may not be
qorto
able to answer every question today, especially if it requires more detailed follow-up.
maadaama waqtigu iska
In
yar
most
haddaa
cases,
waa suurtagal
someone from the Child Care Licensing Division may follow up
su-aasheeda
after the
maanta aanan ka
session.
jawaabin inaan mustaqbalka
And if
aan
your
kula soo
question is
xiriirno sidaan
specific to your
jawaabta
individual
soo jawaab
program, we encourage you to reach out to your licensing specialist. They're the best resource for providing tailored
haddaad
guidance and
su'aalo
support
gaar
based
aad
on your
leedahay
unique
fadlan la xiriir
circumstances.
shaqsiga ku aqbalo
Thanks for helping us keep this
shaqeeyo
session organized.
aad baad u mahadsantaa
Before we begin
ilaahay
today's session, I'd
nidaamka
like to take a
maanta
moment to introduce the incredible team hosting today's webinar.
aanan u guudgelin
These individuals bring a
barnaamijkeena
wide range
maanta
of
waxaan rabaa
experience,
inaan
insight, and
ni baro
dedication to supporting family childcare providers
magacyada
across
iyo
Oregon.
shakhsiyada oo ku
I have
shaqeeya
already introduced myself, but I
hay'adeena
would also like to
sidaan ii
introduce
sheegay
Cynthia
magacayga waa
Smith and
Christina
Jenny Souter,
waxaan rabaa
both regional managers who
baro
provide leadership
Cynthia
and
Smith
support
iyo
to
Jenny
licensed
Sauter oo
staff
ah
and ensure
maareeye
consistent implementation of rules and
maareeye
guidance across their regions.
aqbalsan
We are also
iyo
joined by
gaara
Jackie Barrios, a senior licensing specialist who
Jackie
brings deep
Barriers
knowledge of
oo ah
licensing standards and provider support.
shaqsiga bixiso
From the policy side, we welcome
laysanka
Abby Strom, our Child Care Initiatives Analyst, who plays a key part in developing policy by analyzing legislation,
oo ah
leading large-scale
childcare
initiatives, including rule development,
analyst
and
oo
collaborating
kolka
across
ka
departments
ilaaliso
within DELC to support
polisiyada
childcare
ama
providers and
sharciyada la
families throughout
xiriira
Oregon.
barnaamijka
We
yagu
also have Ronnie Pham, our child care quality specialist, who works on internal and external activities that seek to build quality child care for children, families, and the early learning workforce.
iyo Ronnie Pham oo
Finally, we have Bree Urban.
korka ka
Bree,
ilaalisa
LD's
barnaamijyada
communications and database
ee
coordinator, is here this evening
quality-ga
supporting by sharing the
qaabka
presentation.
daryeelka
I'm
ciyaarka
thrilled to have this team with us today, and I
iyo
appreciate their
Bree
commitment to
Evans
supporting
Irvin
you,
oo
our
ah
family childcare community.
gaarsiinta iyo
Now I'm going to pass things over to Abby to talk more about our rulemaking process.
gaar ahaan hadda waxaan
Thank you, Christina. As Christina said, my name is Abby Strom, and I am a Child Care Initiatives Analyst with the Child Care Licensing Division Policy Team. Before we dive into today's content, I want to take a moment to share with you how we got to this point in the revised rule set.
intaan
This
u
update to
gudbin
the registered family rules is
barnaamijkeena
actually a
koox
part of a much
akhrinta
larger effort happening
isbedelka ku
across
yimaada
all of
Xeerarka ama
CCLD with
sharciyada
a full-scale revision of all
childcare-ka
rules for all licensed childcare programs. We began with the
barnaamijkan
creation and adoption of rules
daryeelka
for school-age programs,
dowladda
then moved
bixiso
to the revision of
waxaan
certified
intaan u gudubin
childcare
rabaan
centers.
inii dulmaro
In the
si
next
qaabkan
phase, we
hadda meeshaan joogo
revised rules for registered family and certified family childcare. You may have also heard that CCLD recently adopted rules for certified outdoor nature-based programs. If you would like to review any of these rule sets, they can be found on the DELC website. As a part of this broader effort, we have been guided by a few key principles that you can see laid out on this slide. And on the right-hand side, you can also see a summary of the engagement that has gone on in this process, which included listening sessions with childcare providers, an online feedback form, as well as community work groups and an advisory committee. Many of you may have participated in one or more of these engagement activities, and we thank you for your feedback. I also want to point out that our work hasn't only come from our formal engagement. A lot of changes that you see today have come from your day-to-day feedback through conversations with your licensing specialists, things that we've heard over time about what needs more clarity and a shared commitment to keeping children safe and healthy.
waad mutaysateen maadaanaad codkiina bixiseen
While we are very grateful that you are all in attendance and here ready to learn about some of these changes,
gaar
please know that
ahaan
not all of the rule changes are covered today.
shaqsiyan baan
Our
ila
new revision of registered family rules is a total revision. The
daryeeladan
rulebook is reorganized for clarity, and
intaan
many rules have been
dadkaas
rewritten to increase understanding using plain language. Because there are a lot of changes, DELC has set up supports for you beyond this webinar. A video series, which will go into depth regarding the changes in each rule section,
dalkani
will
way
be available on
shay
DELC's
wada
YouTube
arkaan
page.
mooyaane
We have a library of new TA documents and materials which you can request from your licensing specialist for implementing the
gaar
new
ahaan
rules.
do
And your licensing specialist is the best
muuqaal ah
resource if you have questions
oo
specific to your
ka
program.
warbixinayo
And
isbeddel
remember, we know it will take time to learn the rules and apply them to your program. Starting in July, when the rules take effect, your licensing specialist will take time at your next licensing visit to make a plan with you on what your next steps will be for implementation. We will be spending the next year providing technical assistance and allowing programs ample time to come in compliance with the new changes. And while your licensing specialists have received quite a bit of training and will be ready for you in July, we know that applying these rules to your program may also take some time for our staff to reflect upon or to look into a bit deeper. We are in a new learning space with these rules, and our system recognizes
waan
that we will
ognaa
all come along
waqti qaadan
with
doonto
you while we work on implementation.
daryeelna
We are here to help.
sidaad
Now it's time to dig into the content, and I will be passing this off to Jackie Barrios.
hadda waxaan microphone u dhiibayaa Jackie Barrios.
Thanks, Abby. Good evening, everyone. My name is Jackie Barrios, and I am a senior licensing specialist from the Salem Licensing Unit. I'm excited to be here tonight and to share these new rules with all of you. I'll begin this evening by reviewing the updated definitions. Definitions are a way to support the rules for childcare, ensuring that the rules are applied as intended. There have been several significant changes and additions to the definitions section.
hadda waxaan in dhul
One
maraya
significant change
erey
is the
bixinta
replacement of
ama
childproof lock
macnaha ereyada
with inaccessible to children.
oo la xiriira
This
sharciyada
change broadens the language and provides more flexibility for childcare
maadaam
providers to use
ereyada
various methods to
sida loo
ensure that
fasiro ama
hazards,
qaabka loo fahmo
toxins,
ay
and
saameyn
potentially
ku yeelan
dangerous
karto
equipment
qaabka aad u
are
fahantay
maintained and
sharciga
accessible to children.
sharcigan sharciyada
While
kala duwan
childproof locks are still an option, you can now
childproof
explore
law
other safe and
waxaa loo
effective ways
bedelay
to prevent access
waxaa laga
to various
doorbiday
hazards.
ereyga
Some
inay
other definition updates include, but are not limited to, child with specific
hadda
needs,
dee
developmentally appropriate,
waa
physical
saameyn waxay ku
restraint,
yeelanaysaa
play
inaad
yard, and
inaysan ku
supervision.
qornayn child proof lock laakiin
These definition updates help
isbeddelkan yar
providers
wuxuu
gain
keeni
a
karaa
clear
inaad
understanding of the rules
haddaad
and
alaab
help
oo
prevent
oo
misinterpretation
khatar
of
ah
those rules.
ciyaalka khatar uu ahaan karo meel aad
Now,
gelin
let's
kartaa
take a
oo
look
aan
at
ciyaalka
some updates
gaarin
related to family child care policies and the communication of those policies to others. First, parents, volunteers, and substitute providers are now required to receive copies of your policies in either electronic or paper format and be notified whenever changes are made to them. This ensures that everyone involved is fully informed and aware of the expectations and
haddii
guidelines
sharciga
that
ama
govern your
nidaamka
program.
isbeddel ku yimaado
Next,
waxaa
mandatory
qasabaa
e-filing,
inuu
which was
inuu
previously required,
shaqaalaha
is
kuu
no longer
shaqeeya
required to be used.
supervisorska dadka
While
bilaashka
it's
ku
still
shaqeeya
important
ama
for
volunteerka
everyone to view and
iyo
acknowledge your
waalidiinta ciyaalka
registration,
inay
there
helaan
is no longer a formal
warqad
written
ku diiwaan
declaration
gelin
confirming that it has been viewed.
isbeddelka ku
Some of the
yimaada
specific
sharciyada
elements that must be included in your written policies
laakiin ma laga
are
rabo
the
declaration of viewing
provider
oo
contact
ah warqad
information,
ay
the work
saxiixayaan
responsibilities, emergency preparedness, and your plan on how to
adiga
respond to
sharcigaaga
emergencies.
oo
Transportation
sharciyadaada
information
waxaa
is
lagaa
your
rabaa inaad
docket,
qortid waxaa lagaa rabaa
behavior and
ku
guidance
qornaadaan
policy,
magacaaga
child abuse and neglect
ganacsigaaga
prevention,
magaciisa
and night care if
diiwaanka
that's
ama
applicable.
adresska businesskaaga ama
These updates are
ganacsigaaga
designed to enhance
telefoonka kale
transparency,
lagaa soo xiriiri
safety,
karo
and
oo
communication
arrimaha
within your
ganacsiga
childcare
khuseeyo
home. So it's essential that you ensure your policies
imisa
reflect
qof
these
iyo
new
imisa
requirements.
qof oo ka shaqaysa
Okay, next,
ganacsigaaga
let's review the rule updates regarding your emergency preparedness and evacuation plans.
hadda
These are
waxaan
crucial for
maraynaa
ensuring that you're prepared
emergency
in
preparedness
case of
iyo
an
response
emergency.
ama
You
qorshaha
are required to
markii wax
have
degdeg
and
dhaca
maintain a written emergency preparedness plan that addresses evacuation,
mar walba
relocation,
oo
shelter in
aad
place,
jideedinaysid
lockdown procedures,
layskaaga
and responding to
oo
medical
ganacsigaaga
emergencies
la xiriira
and other
waxaa la
incidents.
rabaa
The
inaad
new rule also states that
tafatir
you
ku
must
sugtid
review the
ama aad
written
fiirsid
evacuation
haddana
plan and
qorshahaaga
all emergency
oo la
procedures
xiriira
at least
ah,
once per licensing
emergensiyada
period
kala duwan
and
ama
update
waxyaabaha
them as
degdega kusoo kordha
necessary.
waxaa
You
lagaa
must
rabaa inaad
identify
adiga
a licensed physician,
martid ama
hospital, or
sanadkii
clinic
tafatir ku
for
sug
emergency medical
iyo
care, and for
shaqaalahaaga
evacuation
aad
purposes, your
tafatirkaas
designated safe areas and
una
alternate
dhaqmaan
shelters must be
waxaa
at
lagaa
least
rabaa
50
inaad
feet
hisbitaan
away from the home
badanay
being evacuated.
oo gaara
This
aad
distance
qorshaysay
ensures that everyone is
aad
safe
aadi
from
doontiin
potential
haddii wax
hazards or
dhacaan
any further risks. The new rules also
waxaa lagaa
address
rabaa
weather
meel ku
conditions,
qorshaysan oo
temperatures,
ugu
and air
yaraan
quality.
konton
You are now
ka
required to
ka
account for
fog
those
gurigaaga
factors in your
ama
emergency
dhismahaaga
plan,
gurigaaga
including the
aad u
potential for
carari doontid
extreme
haddaad u
temperatures or poor air
baadooy
quality that could impact a
aan khatar
child's
ahayn hadda khatar ku
safety
soo
during
kordho
either an
gurigaaga
evacuation or while sheltering in place.
iyo
You
qorshe
must also
la
have an
xiriiran
emergency
iyo
light source, such as a flashlight, in working condition.
waxaa
These
laga rabaa
changes are
torch
designated to
oo
improve
gurigaaga
safety
yaalo
and ensure that your
oo
program is well
shaqeynaya afar iyo
prepared
labaatan
for
saac
emergencies, no matter what kind of situation arises. Now let's move on to the rule updates related to child enrollment
hadda
forms
waxaan dul
and the
maraynaa
information you'll need to maintain for each child enrolled in your care. You
waraaqaha
now
ama
have the
waxa laga rabo
possibility to
inaad
store
keydsid
children's
oo
records
la xiriira
either in
cunug
paper
walba
or electronic format. The
hadda
key is
waxaa
to
la
ensure that
ogolaaday inaad
records are both
warqadda ku
easily
diiwaangelinta
accessible
ama
and
computerka
securely stored, regardless of their
laakiin waxaa la
format.
rabaa ina meel aad
The
ku
requirement to
keydinaysid oo
include a child's dentist
nabadgelyo leh oo
information
aan
on
qof
the
u kala
enrollment
soo
form has been
heli
removed,
karin
and it is no longer required to be collected. You must also document that parents have received a copy of your policies. This could be a signed acknowledgement form
tarkiisa
or another
ama laga
method
rabo
that
inaad
documents that
information ka
enrollment
haysid
parents have
tan waa la
received and
joojiyo
reviewed your policies.
laakiin waxaa lagaa rabaa
These changes streamline enrollment while
waalid
ensuring that key information is collected and
inuu
stored
ogyahay
appropriately.
nidaamka aad ku shaqaynaysid oo qoran
Now let's
ayba lagu
review the
sheegay warqadoo
update
iyaga
regarding
saxeexay oo
immunization
dhehaysa waan
records
fahmay
and how they relate
sharciyada
to
ama
your
nidaamka aad ku
childcare program.
shaqaynaysid hadda waxaan ka
If
hadlaynaa
a child is enrolled in a
shadan
public or
ama
private elementary school, you are no longer required to document their immunizations in their child file.
hadduu
Immunization
iskool
records will
aado
already be
oo
tracked through the school system, and it
bilaash
is
tahay dowladda
understood that the
ama
school will
koox
meet the
ay
necessary
dugsiga
immunization requirements.
hadduuba iskool aado cunuga ma
These
laga rabo
rules have also been updated
inaad
to allow more
diiwaangashan iyo
flexibility in
tallaaladooda
situations where children may not yet have their immunizations up to date if they are experiencing homelessness. This allows parents or guardians the time needed to take the necessary actions to comply with immunization requirements. These updates ensure that your program can accommodate all children, even if they are in a situation where documentation or full immunization compliance is temporarily unavailable.
hadda waxaa la ogolaaday in cunugu hadduu
Next, we'll discuss
darbi
the rule
jiif yahay
updates for
waalid
parent permissions and
noqoy
when they are
ama
required
uu
for
ku
your
jiro
childcare
foster
program.
care dowladda baa la wareegtay
You must have
mas-uuliyaddii
current written
xaq waxaa u
permission
leedahay
from
inaad
parents
daryeeladan
for
gaarsiin
their child regarding specific
ay u
activities,
qabsan
which
karaan ay
include
ka bixi karaan xaaladda
high-risk activities such as swimming, mountain biking, or any other potentially risky activity.
waxaa lagaa
It is
rabaa
then to
inaad
use
inaad
photographs or
ogolaansho ka heshid
recordings of the
waalidka
child for public
waxyaalaha
purposes, such
khatarka
as on
ah
social
oo
media,
gaar
in
ahaan loo tilmaamo
advertisements, or other
haddaad
public-facing
dabaalanaysid
materials.
baaskiil haddaad
If you're transporting a child or taking them on a
haddaad
field
haddaad
trip
masuuqa
outside of the
qaaday
immediate
ama
neighborhood,
waxa laga duubayo cunuga
prior written permission is required
waxaan
for
kaa rabaa
anyone
inaad
picking up a
ogolaanshahaas
child
haddana
under
haddaa
child
qoran
care
oo
who is
daban
not listed as an
haddaad
authorized
cunuga
person
meel
in a
geynaysid
child
gaar
care
ahaan
home.
aan ahayn dhisma
Additionally,
ciyaalku
written permission must be obtained before allowing a school-aged child to arrive or leave your child care alone. For chronic medical conditions, you may obtain written
haddaad
permission with specific
haddaad
instructions
haddii waalidka rabo
when administering
cunugiisa loo
medication
fasaxo
for up to
in
12
meel u
months.
lugeeyo
Examples would include
ama
dental
meesha ka
cleanings
baxa
and
ama soo galo
inhalers.
waxaa lagaa rabaa
If a
inaad
family is experiencing
war
homelessness, there
ogolaansho
is
warqadda ku qoran
flexibility in cases where written permission is not obtainable due to the family's circumstances. Permissions can be provided verbally as long as you document the date and the time you were given permission and maintain that in the child's file.
isbed
Electronic permission, such
wa-
as through a
waa
text or an
waa
email
lagu ogol
message,
yahaa
can also be
haddaadan
used
haysan
as an accepted form of
ogolaansho
permission.
oo waalidka ka timid oo
These
qoran
updates
laakiin
ensure that you maintain
aad
appropriate
tusaale ahaan
permissions
haddii afka
while
kaaga
also being
sheegan
sensitive
ama
to the
hadday
circumstances of
adeegsadaan
families
telefoonka
who may
texas
be facing
waa la
challenges.
ogol yahay laakiin adiga
Now
mas-uuliyadda ku
let's
saaran
cover
waxa
some
weeye
significant
inaad
changes
inaad qortid
related to the
waqtiga
drop-off and pickup procedures for your
messagekaas ay
childcare
kugu
home.
yiraahdeen ama ay kusoo
One key update is that you must require any person bringing a child to the child care home to remain with the child until a caregiver accepts the child into care.
isbeddel
This ensures
oo
that
muhiima
children
oo soo
safely
kordhay
transition from
waxa
their
weeyaan
parents' care to
cunuga
home.
marka la
This
keeno
also helps
xanaanada
maintain
inuu
accountability and
waalidka
ensures a smooth
shaqsiga keenayo
transition.
cunuga inuu la
For
joogo
pickup,
ilaa aad
the new
cunuga
rule
ka
states that you
xaqishid
may only release a child to the parent or another person identified and named by the
besina
parent.
waxaa lagu ogol yahay inaad
If
cunuga
the
u
person picking
fasaxdid
up the child is
markuu
not known
dhammaado
to you,
xanaanada
they
ee
must show identification
gacanta
before the
gelisay
child can be
waalidka
released.
ama shakhsi ayaga
Additionally,
ah,
except as
ee
excluded by court order, parents
ay
must
ku
be
ogolaadeen
permitted
in
access
cunuga u
to their
fasaxdo
child and all child care areas while their child is in care. Advance notice is not required. These updates are designed to enhance safety during drop-off and pickup times and ensure that children are in the hands of those whom their parents have authorized.
sababta
Next, we'll review the requirements for
isbedelkan
maintaining personnel
waxa weeye in
records for
cunugu
substitute
lumin
providers.
oo bis loo ogolaado
A
qof
registered family
waalidka
provider
u
must
ogolaado
maintain current personnel records for each substitute provider, either in paper or electronic format.
waxaa lagaa
These
rabaa
records must
shaqaalahaaga
include the following:
inaad waraaqa
Central Background Registry or CBR
oo dee
confirmation
inaad
letter,
inaad background
This
check la
letter
marteen
confirms that
ay
substitute providers
inay
have
qaateen
enrollment in the CBR. If a
CPR.
substitute provider does not yet have a CBR letter, you must keep written documentation showing that you have verified with the Child Care Licensing Division, or CCLD, that the caregiver is enrolled in the CBR and linked to your child care home,
Waxaa lagaa
including the
rabaa
date,
inaad
time,
inaad
and the name of the
warqad
CCLD
ama
staff
computerka
member that
record
you spoke
ku
with.
keedisid oo
They
tusaysa
must have current
shaqaalahaaga
pediatric
inay
CPR,
diiwaangelin yihiin,
first
inay
aid,
xiriirna la
and
leeyihiin
handler
CPR-da
certification.
iyo CCLD-da.
Finally,
Ugu
their
dambeys,
records must also include evidence of participation in an orientation.
waxaa lagaa
By
rabaa
keeping these
warqad oo
records up to
caddeynaysa
date, you
inuu
help ensure that
orientation
all
qaato
caregivers,
shaqaalahaaga.
whether permanent or substitute, are qualified and prepared to provide safe, high-quality care for the children in your program.
Maxaa sabab u ah ina
Now let's
waxaan dhan laga
talk
rabo
about the
sida loo
updates
hubiyo
related to
yaal
attendance
walbo
records
ama
and what
shaqaalahaaga inay
documentation
ay
you need to
ay
maintain for your
ay
child care
og
home.
yihiin
A registered family home must
nin
maintain
walbo
current days of
qaabka
attendance
loola
record in
dhaqmayo oo
paper or
nabadgelyada
electronic format.
ilaalinayso sida ay
The
dowladda
attendance record must include the child's full name and the times of their arrival and departure.
waxaa lagaa rabaa
This
inaad
record shows the
kaydisid ama
children in
record
attendance
gelisid ama
at any
qortid
given time.
waqti walbo cuniga
If a substitute
kasta
provider is
imaado
caring for children,
magaciisa oo dhan
the attendance record must
qortid
include their name as well as the date and time of their
maalinta
arrival and
taariikhda
departure. In
ay soo
addition to
boqdeen
attendance
waqtiga ay
records,
soo boqdeen waqtigana
several other important pieces of documentation must be maintained. Written reports must be kept for any injuries,
lagaa
documentation
rabaa
of
inaad
any
haddii cunug
medication
dhaawac
that
gaaro
was administered
inaad
to a
qortid
child, along with any side
keydid
effects they may exhibit.
daawo walba aad
And
siisid
lastly,
cunug
you
walba
are
iyo
required to keep a written
isbedelada aad ku
record of
aragtid
any
oo
suspected
oo
child
saameynta
abuse
ay
or
ku
neglect
yeelatay
reports
daawadaas
made
haddaadna
to the
arag
Department of Human Services, Child Welfare, or law
haddaadna aragtid
enforcement.
cunugu inuusan helin
This is a
daryeelka loo
critical
baahan yahay
part of your
ama
duty as a mandatory reporter
waxaa lagaa rabaa
aimed
inaad
at
dowladda u
protecting children
sheegtid
and
haddaa
complying with
cunugga
legal
aragtid
requirements.
daryeel la-aan ama
These documentation
nabadgelyadiisa
updates
inaysan
help
sugnayn
ensure that your program operates
sida
transparently,
dowladda ayna
safely,
farayso
and in
waajib
compliance
adiga ku
with all
saaran maayo
regulations. Keeping accurate records is key to both safety and accountability. Now let's discuss important updates regarding the accessibility of records and their use in emergency situations. You must make all records required by these rules available to CCLD at all times.
waxaa lagaa rabaa
Additionally,
waraaqahan
there
dhan
must be
oo
at least
inaad
one caregiver
keydid
on
sidaan
site
kuu
who can
sheegay
access
haddaanaba
any records stored
keydkaasna
in either
waxaa
paper
lagaa
or
rabaa
electronic
afar iyo
formats.
labaatanka saac inay
One
hadday u
critical
baahato
update is that electronic records, including but not limited to
inay
children's
heli
records
karto
and the current day's
inay
attendance,
diyaar yihiin
must be portable in case of an emergency evacuation.
waxaana lagaa rabaa inay
This allows ease of
jirin
taking
meel
records with you quickly and
hadday wax
securely if you
kasoo
need to
kordhaan
evacuate the child
gurigaaga
care home.
oo dee
For
inaad ka
electronic records,
wax
you must
qaadi
also
kartid
have procedures in place to ensure
waraaqo
prompt
ama
access during an emergency.
marka haddaad ku jirto wax la
This
qaadi karo
includes
si
having
aysan
a
guriga
backup
u
system,
gudbinin
either
haddii
on
guriga
site or
alaabahaas
off
ay
site, to
gudnayn
safeguard your records and ensure access in the event of data loss. Whether through cloud storage, an external hard drive,
cloud
or another secure
storage
backup method,
isticmaalaysid
it's essential that these
ma
records can be
haddaad
retrieved
meel
when needed.
waraaqaha ku keedinayso aanan
These
guriga
updates
waxaa
focus
lagaa
on
rabaa
ensuring
inaad
records are
ilaalisid
both secure and accessible during routine operations, as
kaydkaaga
well as in the event of an emergency,
hadday
ensuring
wax
that your
dhacdo
child care home remains compliant and prepared. Now let's talk about updates related to required notifications for serious injuries and incidents. The new rule requires that any serious injuries or incidents be reported to CCLD by 5 p.m. of the next business day. This
hadda
ensures that incidents are addressed
haddii
promptly
dhaawaca
and
gaaro
that
cunuga
CCLD is
oo
kept
dee
informed of
khatar ah,
any serious
waxaa lagaa rabaa
situations that may
maalin
occur
ku
in your
xigto
program.
oo dhaawacaas gaaro
There's
ugu
also an
dambeyn
expanded
waqtiga
list of
markuu yahay 5
situations
p.m.
that must be
inaad la
reported
soo
to the child's
xiriirtid
parents
CCLD
immediately
aadna
and
ku
documented.
warbixisid wixii
These
dhacay.
include if a child sustains an injury that may need evaluation by a medical professional, you must inform the
hadduu
parents
cunugu gaaro
immediately.
dhaawac oo
Also,
aad
any
filaysid dhakhtar u
injury or
baahan yahay
impact to a
daryeel
child's
caafimaad
head must be reported to the
wax
parents
walba oo
immediately.
madaxa la xiriiro gaar
Head
ah
injuries are
dhaawac
a
haddii madaxa
significant concern, and it is essential to keep parents informed so they can take appropriate action if needed.
dhaawacyada madaxa waa
These
wax khatar ah
updates are
waana
aimed at
muhiim
improving
inaad soo
communication
gaarsiisid
and
gaar
ensuring
ahaanba
that both
waalidka
the childcare
siday
provider and
siday u
parents are
gaarsiin karaan
informed as
una
soon as
geyn karaan
possible
goob ay ku helo
about any
cunuga
serious
daryeel
incident that
caafimaad.
may affect the child's well-being. Before we move on to our next section, I'm going to take a moment to check in and see if we have any questions that need to be addressed.
intaanan u
Ronnie, do
gudbin
we have any questions?
hadalkeena kala
Thank you for pausing and giving this
waxaan rabaa
opportunity,
inaan
Jackie, but we don't have any questions at this time.
Great. All
Jack,
right. Thanks,
aadan
Ronnie.
maayo
Now
su'aalo
I'm going to hand things over to Jenny to discuss
hadda
updates to rules around
Jenny
Central
baa
Background Registry
dhiibaya
enrollment.
mikrofoonka oo ka
Hey,
warbixin
Jackie.
doonta
Good evening,
isbedelada
everyone. My name is Jenny
nidaamka
Fowler,
gaar
and I am the
ahaan
regional
background
manager from the
budget
Portland area.
enrollmentka
I'll be
ama
discussing any updates
CBR sida loogu
regarding
diiwaangeliyo
individuals
oo
who
baarayo
live on the premises
taariikhda
of your child
shaqada
care
ka
home,
shaqeynayo goobta
such as
iyada
those living in an accessory dwelling unit or an ADU, and their involvement with the child care program. If there are
haddii
individuals
hadda
living
waxaa
on
la
the premises
ogolaado hadduu
who do
shakhsi ku
not
nool
have
yahay
access to the child care space for
adresskaaga
the children,
oo
there are some
laakiin ku nool
specific
yahay
allowances in place.
aqal
These individuals
gadaal
are
ku
not
yaal guriga
required to be
oo gaar
enrolled
ah
in the central
oo
background
aanan
registry,
aanan ka
as long as they
shaqeynaan
do not
goobtaada
interact with the children or have
gurigaaga
access to the
ama
child care.
goobtaada aad
This
ganacsigaaga
is
ku
designed to
wadatid
ensure that
inuusan
any individual who
shakhsiga
have
meeshaa ku
direct
nool
contact with the
isku soo
children
geli karin
or who work in
shakhsiga
child care
adigoo
are
isku
subject to
adres
the
tihiin
CBR
inaan
requirements.
laga rabin inuu
If
back
someone living on the premises does
aadaan
not or
gurigiisa
does have
isku
access to
adres
the
aad tihiin
children or the
laakiin
child care area,
um,
they would
gurigaa
still need to go
waa
through
guri
the
gaar
background check process
dhismo
and
gaar
be
ah
enrolled in the CBR.
tusaale ahaan waxaa la yidhahdaa ADU-ne
Now let's discuss important updates related to child or caregiver training and the use of the organ registry online.
hadda waxaan ka hadlaynaa isbedelada ku
All
yimaadeen
caregivers
um,
employed by a
muhiimada
registered
ay
family
leedahay
provider must have
tababarada
an active
socda
account with ORA.
oo laga
This
helo
is a
Organ
state
Registry
online
Online ama
system for
ORO
tracking, training, and credentials. It ensures that all caregivers are
shakhsi
properly
walba
registered
oo ka
and that their
shaqeeya
training
goobtaada
records
iyo
are
adiga
updated.
waxaa lagaa rabaa inaad
Additionally,
active
all
account ma
training
ku
must be
diiwaangelin
approved
tihiin
by
online
ORA
Organ
to count
Registry
towards
Online
required certification.
training walba ama
Another change is that recognizing and reporting child abuse and neglect training can now be taken every 3 years instead of every 5 years.
waxaa lagaa rabaa
as it was previously.
inaad
This is just
qaadatid
help
casharka la
ensure
yiraahdo
that
recognizing and
caregivers are
reporting child abuse and
consistently
neglect
updated
um,
on best
saddexdii
practices
sano
and
hal
legal
mar guriga hore
requirements
waxay ahaan
when it
jirtay
comes to
shantii sano
identifying and reporting child abuse and neglect. These changes aim to keep training consistent, up to date, and properly documented to
sababta
ensure that all
saan loo
caregivers are
subiyo waxaa
qualified
weeyaan
and prepared
inaa
to provide safe,
inay
effective care for
in
the
aan
children in
aqoonsado
the program.
muhiimadda ay leedahay laakiin isbedeladan ay ka imaani
Next,
karaan
let's go over some important updates related to the environment
aqoonta
where the children are napping or resting
oo
and
tababarada
for their
hoosyaala.
safety.
sida
We
isbedeladaas
must
lala
ensure
jaan
that there is
qaado
sufficient light in any
shantii sano
room
waxaa
where
laga dhigay
children are
3
napping
sano
or resting. This is important so that caregivers can clearly see each child's face from any point in the room. It is also important to be
waxaa lagaa
mindful
rabaa
of
inuu
background
iftiin
noise and
jiro
rooms
qol
where
walbo
children are napping.
oo yar hadduu
Whether
meesha
you're using
ciyaalka ku
music,
seexdaan
sound machines,
sidaan
or light
qofna
music to help
dee
children rest,
sida
the
cunuga
noise
hadduu
must
soo
not
kaco
be too loud.
uu heli karo
When a caregiver is in a
baabka
quiet
ama
room
qaab
with a
qolka uga
stillness,
baxo aysan ahayn mugdi oo aynan ku socon karin, iyo shaqaalaha.
To perform frequent audio and visual checks as well.
Haddaad isticmaashid agabka background noiska agabyada dee oo cod bixiyo sida cunugu uusan wax kala maqlin, inaadan codka sidaa u dheeraan sida aad adiga u maqli kartid haddii cunugu khatar ku jiro.
Let's talk about updates that focus on the ways in which caregivers communicate and interact with children to foster a positive and supportive environment.
Hadda waxaan dul maraynaa qaabka aan rabnaa inaad la
Interacting with children,
macalintiin.
we must ensure that the environment promotes healthy, culturally responsible, responsive child development. This
Waxaan
means
rabnaa inaad
creating space where children feel heard,
qaabka aad ciyaalka la hadashid inay ku salaysan tahay nidaam
examples of this,
waanan
giving
ciyaalka
encouragement and positive feedback,
anshaxood
build confidence,
wax yeelaynin.
modeling active listening,
Waxaa laga rabaa cunugu markuu hadlo inaad
listening to
dhegeysid
children at
iyo
their
si
eye level,
ixtiraam leh
helps them
aad
feel
la
valued
hadashid
and included.
cunuga, inaad cunuga
Providing kind
indhahaaga
words
indhahooda ay
to
sameyn
foster
yihiin
a
markaad la
welcoming environment.
hadlaysiin. Waxaa lagaa rabaa in
Navigating
ciyaalka
children's
si
feelings
nidaamsan
and
oo
ideas
wanaagsan
so they
aad u
know
soo
their emotions
dhaweysiin
are acknowledged,
iyo aad u nabadgelisiin markay
using
sii
a calm,
hayaan.
encouraging tone of voice.
Markay kula wadaagaan shucuurtooda inaad aqbashid,
Being curious
aadna
about
ugu
the
soo
individuality
waxaad
of each child and their
sidaad
goals
shucuurtooda u
to
qiyaastay.
better
Интересуюсь ребенком
support
и
their unique
индивидуальностью
needs.
каждого ребенка и его фамилии.
I would like to continue on creating healthy climate for
Нам
child
нужно
development.
создать безопасное
We
помещение.
must encourage.
Интересуюсь возможностью.
Can we use their mic?
I think, hold on one second. I believe I need to move one of the interpreters to the language room. So Jenny, could you
Oh,
just
thank
hold
you.
for 1 second and let me do that?
Absolutely.
Is
Thank
it,
you, Abby.
do they need to go, is it Spanish? Or which language? Russian. Oh, thank you. I will move. I'm sorry, I should know that. I will move the individual to the room. Jenny, I'll let you know when you can start again. I believe the interpreter's been added, so Jenny, go ahead and start.
Thank you, Abby.
Mm.
Continuing on with our discussion about creating a healthy climate for child development. You must also encourage positive interactions between children. Some ways to support
Waxaan
this
rabnaa
include
inaad
modeling social skills,
ciyaalka
На пути создать
so children learn
это
how to
включает в
interact
себя
with others
создание
respectfully.
социальных навыков, эмпатию, так, чтобы дети учились, как взаимодействовать с другими с уважением.
I'm going to go ahead and continue. Helping children understand their feelings and the feelings of others, fostering kindness and compassion. Supporting children who may struggle to make friends by guiding them and creating opportunities for connection. Encouraging play between children of all abilities and backgrounds to promote
cunuggu dee hadduu
inclusivity
asxaab
and mutual
lahayn
respect.
inaad
Lastly, it's
dhiirigelisiin
important to know
inay
that when
asxaab
caregivers are
sugsadaan
lifting or moving a child,
iyo
they must
ciyaalka
do
dhan
so in a way
inaad
that
ku
ensures
dhiirigelisid
safety and comfort
oo
for the child.
xanaanadaada
This
joogaan
includes
inay
using appropriate
si fiican
techniques
isla
and being
isla
mindful
jaan
of
qaadaan
the
oo
child's
si fiican
comfort
isla
throughout the
dhaqmaan,
By implementing these
ilaalinaysa
practices,
nabadgelyada
children feel respected and
nabadgelyadooda,
valued,
jirkooda iyo
able to
maskaxdooda
navigate
iyo
relationships
shucuurtooda.
and emotions, and to help providers foster a nurturing and supportive environment that prioritizes both the emotional and physical well-being of the children in their care. Let's talk a little bit about updates regarding daily routines and activities and how the schedule should be structured for the children in care.
hadda waxaan ka hadlaynaa
One of the key
jadwalka
changes
maalintii.
to the screening time guidelines. The new rule adjusts
Jadwalku
the
waxa weeyaan
daily limit from 2 hours a day to a weekly limit of 10 hours a
guriga hore
day
waxay
for
ahayd
school-aged children
2
and
saacad
5
maalintii
hours
la
for
ogolaayo
those
cunugu
children who
inuu
are
inuu
preschool and
shaashada
younger.
eego. Hadda waxaa la
This
bedelay
gives more flexibility
maalintii ma lagu
while still
koobayo,
limiting screen
waxaa lagu
time
koobayaa
to ensure that
usbuucii
children
ama
have a healthy balance
toddobaadkii
of
10
activities
saacadood
throughout the week.
for ciyaalka oo skoolka
Another
dhigta.
important update
Laakiin ciyaalka
is
aan
must
skoolka
ensure daily
dhiginin
outdoor play
oo
for
ka
each
yar
child,
da'da waxaa
regardless
lagu
of
ogolaadaa 5 saacadood
bearing in mind that
usbuucii ama
weather and
toddobaad.
environmental conditions do not pose a health or safety risk. It
Laakiin
helps
kaa
ensure that
ogow,
children get
kaa waa
physical
shaashada
activity
inta
and fresh
waqtiga
air
loo
use
ogolyahay.
every day.
Mas-uuliyad
This is
waxa
important
ku
for
saaran
both
inaad
physical
cunug
and
walbo
mental development.
inaad hubisid waqtiga lagu taglo inuu jirkiisa dhaqaajiyo oo
Continuing
banaanka aado.
reviewing this rule, we will talk about how they are required to follow consistent daily routines that should allow flexibility. This flexibility ensures the needs of the individual children and the group are addressed. It's important to balance structure with the ability to adapt to
Jadwal
the
inaad
children's
ciyaalka u
needs as
dhigid
they evolve.
waa dee ay qiyaasi
The
karaan
routine
oo
must include several key
waqtiyada
components
sida
to
aad
support
siinaysid
children's well-being.
waqtiyada
Regular
musqusha
such as
musqusha la
feeding,
aadayo,
wrapping,
la
and feeding,
seexanayo, la cunteynayo.
a balance of
Laakiinna
active and
inaad
calm
dee
activities
jadwalkaaga hoos
allows
u
children
dhisid
to engage in both
oo haddii
energetic
wax
play
cusub
and
jiraan.
calmer performance. Individual choice time, where children can select activities that interest them, as well as group activities that promote socialization and cooperation. Indoor and outdoor activities every day, ensuring children have a variety and the chance to explore different environments.
Waxaa lagaa rabaa inaad
Emphasize
ciyaalka
creating a
fursad
well-rounded
siiyeen wax
balanced
cusub
daily routine
ay
that
maalin walba
supports the
isku wax ay
developmental needs of
sameynaynin
the children
aadan ay
while
ku yeelan
maintaining
karto
structure
saameyn
and flexibility.
kobcintooda.
Before we move to our next section, I'm going to take a moment to check in and see if we have any questions that need to be addressed.
Intaanan u gudubin
Bonnie, do we have any questions
qodobkayga
now?
cusub, waxaan rabaa aan eego inay su'aalo jiraan. Su'aalo ma jiraan?
Thank you, Jenny, for giving us a chance. No, we don't have any questions at this time. Thank you.
Waqtiga ahaada.
Ronnie, I just want to, since we've had this question a couple times in the chat, I want to make sure folks know that a recording of this webinar will be uploaded to the DELC YouTube channel, and which is just if you search for the Department of Early Learning and Care on YouTube, it will bring up all the videos associated with DELC. There will also be links to this video along with also the videos that are done in other languages on the DELC website.
Maadaama dhowr qofood weydiiyeen muuqaalkan la
Going
duubay
to hand it over to
wax
Cynthia
laga heli
to
karaa
discuss more
YouTube
changes to
iyo
infant and toddler care.
afafka kala duwan
Thank you,
waana
Jenny.
laga duubayna
And
waa
thank you, Ronnie and Abby, for chiming in about questions and the recording. Welcome, everyone. My name is Cynthia Smith, and like Jenny, I'm also a regional manager for the Portland area.
magacayga waa Cynthia
I'm really excited
waxaan
to be here
maareeyaa
tonight because I
aqoonsan
get to talk about
Portland
infants and toddlers
ee
like everyone,
magaaladan
and we're
gaarkeed.
going to
Maanta
talk
waa
about
farxad inaan
infants and toddlers and rule changes
aanan
around
ka
movement
hadlaya
and use
ciyaalka
of
ku
restrictive
dhacayo
equipment.
oo 5 sano ka yar.
Infants and toddlers must be given the opportunity to interact and be near one another. This
Ciyaal
helps with their social, emotional
ciyaalka
development and
yaryarka oo
promotes a sense of
2 jir
connection,
ah
which is so
ilaa
important
ah
for their
waa
emotional
xaq
well-being.
waa qasab inaad
A
fursad
key update
inay
is that
isla
restricted
hadlaan.
infant equipment such as bouncers, exercisers, swings, infant seats, high and low chairs, or structured infant carriers must be
Waxaa lagu
limited in
ogol
use.
yahay
A new rule
ciyaalka
limits the
da'daas
use
jira
of these
inaad
types of
ku
equipment no
xirtid
more than
ugu
30 minutes
badnaan
within
30
school hours.
daqiiqo labadii
This ensures
saacadood
that the infants have ample time to move freely, which is crucial for developing their motor skills and muscle strength.
maadaan
There are exceptions where the
ciyaalku wuxuu u
30-minute
baahan yahay
time limit
jirkooda inuu
may not
kobco
apply.
inay
For
dhaqaaqaan
example, if the infant is actively engaged in eating, stroller walks, car rides, the time
haddii
spent
cunuga
in brushing teeth
cunteynayo
may
baabuur ku
exceed the
jiro
30-minute limit. These
ama
activities are
ama gaari
necessary
gacan
for
ku
the
jiro
child's routine, but they don't
30
restrict
daqiiqo
their
waa
development in
dhaafi
the same way.
kartaa
These updates are designed to support infant physical social development by limiting the use of equipment that restricts their movement and encourages natural
maadaama
interactions and
cunuga
activities.
uu korayo jirkiisa dhaqaaqaas koritaan
Next, let's cover important
taankiisa
updates
saameyn
regarding the
wanaagsan
feeding of
ku
infants,
yeelanaya
particularly around
waxaan rabaa
human
inaad
milk,
ilaalisid
formula, and the introduction of
marka
solid
waqtigaas
foods.
helo
There are now specific requirements for storage, preparation, and serving of human milk and formula to ensure practices are safe and hygienic. The new rule has been introduced that no juice of any kind may be served to infants. This helps reduce the risk of early childhood cavities and ensure infants get the
ciyaalka
nutrients they need
oo
from
oo la
breast milk and
siinaya
formula, not sugary
caanaha
beverages.
oo hooyadiisa laga
Another
soo
important update is that infant formula cannot be mixed
bedelaa
with
ku
cereal,
yimaada qaabka
fruit juice, or
aad
other foods
u
unless there is
keenaysid
written
gaar
permission from
ahaan
a medical
talaagada aad ku
practitioner.
gelinaysid
Lastly, infants under 6 months
biyaha
of age
sonkorta ku
may
jiraan
not be given water
oo
to drink
qudaarta ka
unless
timaada
there's
gaar
written
ahaan
approval
fruitka
from a medical
ma
professional.
la ogolo si
These
toosa
changes ensure that feeding practices
inaad
are
inaad
safer
ciyaalka
and more
siid
appropriate for the
maadaama la
developmental needs
diidayo
of
ciyaal
infants,
inay suusyo
helping
ku
to promote the
qabsadaan
overall health and
ilkahooda
nutrition. Now let's talk about the updated rules for
ana
crib,
boodahana maku
portable
qasbi
cribs,
karto
play
yaryar
yards, and family childcare settings, ensuring the safety and comfort of infants during nap time. You must provide each infant with an individual crib, portable crib, or play yard to ensure a safe and personal sleeping space. However, you are not required to have a separate crib, portable crib, or play yard for every infant enrolled, only enough for each infant to have their own when needed. The sleeping surface must be firm, flat, and non-inclined to reduce the risk of suffocation and unsafe sleeping positions. The mattress must meet the following criteria. It should fit tightly in the crib or play yard with no gaps between the mattress and the side of the product. Must be covered in a durable, washable, waterproof material. Be firm enough to hold its shape and not indent or conform to the infant's head, and must be covered in a tight-fitting sheet that stays in place with regular use and no slacking or bunching. These requirements aim to ensure that the infants have a safe, secure sleeping environment that complies with the latest safety standards, reducing the risk of injury or suffocation.
qalabka iyo
Next,
habka
the
fadhiga
slide
ee
continues
dhalinyarada
to
iyo
discuss
carruurta
more
yaryar
changes regarding
ilmo
infant
kasta waa
sleeping,
inuu loo hayo
safety,
sariir
and
gaara si
developmental
la qaadi
materials
karo
in
ama
family
meel
childcare settings.
lagu ciyaari meel lagu
It's
ciyaaro
important to note
waa
that
inay
bassinets,
sidoo kale
stacking,
la jaan
wall, or
qaadaan
modular
heerarka
cribs,
guddiga
and crib bumper
badbaadada
cribs are
alaabta
prohibited.
macaamiisha ama
These
CPS
types of equipment do not meet
ee
current safety standards for infant
lagu
sleeping
talagalay
environments.
isticmaalka dhallaanka
Sheets must be
lana
changed when
hayo
stored before
dukument
use by another child and at a
muujinaya taas
minimum of
ku
once a
socota
week.
shirkadda soo
This
saarta
ensures a clean and
sariirta
sanitary
waa
sleeping
inay tahay
environment
mid
for
adag
each infant.
si fiican u
In
fadhiyo
support of
isla
traditional
markaana
indigenous
lahayn
practices,
meel la
cradleboards
siin
or other traditional
waa
indigenous sleep
inay
equipment
buuxiso
may be
shuruudaha
used as the
waxa
sleep surface for infants. However, caregivers must exercise caution and make sure to not overbundle or overheat an infant while using this equipment, ensuring the child's comfort and safety. Next, let's review an important update regarding materials and toys in registered family childcare settings.
sariiraha
You must
yaryarka
offer a
ee
variety of
lagu
materials
talagalay
that are
dhallaanka
developmentally appropriate
daaqsinka
and
yiraahdo
stimulate
waa la
the child's senses.
mamnuucay
This
sariiraha la
means including
saaro
materials that
kuwii
encourage
gidaarka
exploration,
ku rakiban ama
creativity, and
kuwii
engagement,
isugu
tailored
keena
to the
qaybo
child's age and
ama modular
developmental
cribs
level.
la yiraahdo waa la
Materials and toys must not pose a choking hazard.
xadhigana dhinacyada
Encouraging
saliidda
safety
xanibo
of
ama
your children.
bumper pads
This
lagu
includes the
oggolo
following:
in lagu
small objects with a
isticmaalo
diameter less
daryeelka
than
carruurta ee
1¼
qoyska.
inches, plastic bags,
Go ama
styrofoam coatings,
baakadaha
and
sariirta
rubber or latex
waa in la
coatings.
bedelo marka ay wasakhoobaan ka hor inta aan
And
ilmuhu
finally, let's review an important update regarding infant equipment restrictions and high chair safety in registered family childcare settings. Certain infant equipment can no longer be used due to safety concerns. These include baby walkers, doorway jumpers, accordion safety gates, bean bags,
habka
water
dheeraad
beds,
ah ee
dry
dhallaanka
pads for
ee
sleeping,
aan
and
la ogolaan
unstructured
in la
infant slings
isticmaalo
or wraps.
soo socodka
These
dhallaanka
items
si
pose a risk of falls,
boodooyinka
fall hazards,
albaabka ama doorway
suffocation,
jumpers,
dangers, and a lack of proper
albaab-xiyayaasha
support for infants.
islaalaaban ama
If you
accordion
do use a high chair, they must comply
kuraasta
with the
beanbag
Consumer
ah
Product Safety Commission
xiriiraha
standards
biyaha
and
ama water
include
beds
a broad-based
oo
prevent
ama
tipping,
xumbo
a latch to keep a child from
talagalay
raising the
muddo
tray, and a T-shaped
suumanka
strap to
ama
guard and
marada
prevent
aan
entrapment or sliding
habaysan
out.
ee lagu talagalay
These changes
qaadista
are
dhallaanka.
designed to enhance infant safety and reduce the risks associated with improper equipment use.
sababta loo mamnuuco waxaan waxa weeye in nabadgelyada ciyaalka la ilaaliyo.
Next, let's review some updated safe sleep guidelines for infants, which have been
Hadda waxaan
clarified to
hadlaynaa
align with the
isbedelada ku
American
yimaada
Academy of Pediatrics recommendations. These changes emphasize safe sleep practices and protect infants while they sleep. While infants are sleeping, you must monitor them frequently to ensure their safety. This includes checking to make
Markay
sure that
hurdaan
the
dhallaanka waa
infant
in
is
si
breathing
joogto ah
properly,
loo
is
kormeero
not overheating, is
si loo
not in
hubiyo
distress,
inay si
and does
caadi
not need
ah
any
u
immediate assistance.
neefsanayaan, aanay
Infants must always be
meel
placed on
xad
their
dhaaf
backs to
ah
sleep.
qabin,
They
aanay
should be placed on a
dib u
flat,
jirin, isla
firm,
markaana aanay
non-inclined surface
u
to
baahnayn
reduce the risk
gargaar
of
degdeg ah.
suffocation or
Dhallaanka
other
waa inay
sleep-related accidents.
dhabarka lagu seexiyo
And for
meel
infants who can roll
adag
from back to front or back to side,
leexsanayn
they may
ama
remain in the
janjeeraynin.
position they assume.
Dhallaanka awoodda u leh inay isu rogaan dhabarka ilaa caloosha ama
As we
dhinaca
continue to focus
dhinaca
on safe sleep,
waxaa
we
loo
will now discuss
yahay inay
what should and should
jiraan
not be in
qaab
or around
hurdada
an infant's
ay
sleep
iskood
space.
iskooda u
Infants must never have their heads or faces covered by blankets, linens, or other
wejigooda
items while they are asleep.
dhallaanka wejigiisa
Additionally, no item shall be
korbeed
placed
ma la
over the
ogola
top or
inuu
sides of the
socdo.
crib, portable crib, or play yard, such as tents or sheets. Items such as headwear, bibs, necklace, and garments with ties or drawstrings
Ilmaha waa
must be
in
removed from the
madaxdooda ama
infant
wejigooda aan
before
lagu
they are laid down to sleep.
waxyaabo si bustayaal
Clothing or
oo
any other type of clothing or covering
waa
that
in
restricts the
inaan
infant's neck or
waxyaabo
leg movement
tusaale
is
bustayaal
prohibited at all
xindhooyin
times,
go lagu
even when
saaray
the child is
ama
not
dhinacyada
sleeping.
sariir la
Additionally,
qaadi karo
weighted
oo
blankets,
meel lagu
weighted
ciyaaro
clothing, or any other
waxyaabaha
weighted
keeni
object
karo
should never be placed near or
neefsasho
on
xumo
a
ama
sleeping infant.
xirnaansho sida koofiyadaha shaararka leexadka
Additionally,
madaxa
only a plain
iyo
pacifier is allowed in the crib,
ilmaha
portable
ama
crib,
dhar
or
kale oo
play yard.
xidhiidha
No pacifier clips, bottles,
gacmaha
blankets,
ama
pillows,
lugaha
stuffed
ilmaha waa
animals,
nuuc
blankets,
waqti
or
kasta.
bumpers shall be present. Lastly, if you are holding or carrying a sleeping infant in a structured infant carrier and are engaged in an activity, you must move that infant to a safe sleep surface as soon as the activity is finished.
Marka la rabo
If you're
marka
holding
laga
a
reebo
sleeping infant,
maqraabta
you must
caadiga
remain
ah
awake,
plain
alert,
pacifier
and focus
wax
on that
kale looma
infant and
ogolo
be able to immediately observe
lagu
or
dhigo
feel
ama
any
lagu
signs
xiro
of
sariirta
distress.
sariirta la qaadi karo
By
ama
keeping the
meel
safe
lagu
sleep
ciyaaro
safe,
tani
the
waxay
sleep space safe and
fudud
free of
maqraabta
unsafe items, and following these best
alaabta
practices, we can
carruurta
help ensure that infants'
xayawaanka
rests are
jilicsan
safe and comfortable.
bustayaal ama suufyada dhinacyada ama bumpers kan loo
Next,
yaqaan.
let's go over the updated guidelines for diapering practices in family childcare settings, which focuses on ensuring the health and safety of the children in your care.
Waxaan ka hadlaynaa
Diapers must be checked at least every 2 hours unless the child is sleeping, or more frequently if the
xaaladda
child needs to
xasaasiyadda
require it.
musqul gelinta
The rules have been
xaafiyadaha
clarified
waa in
regarding
la
diaper
hubiyo
changing
ugu
areas.
yaraan 2
It is
saacadood
essential that the
oo
area is
ama si
maintained
ka
with
badanna
cleanliness
haddii
and
loo
bleaching
baahdo
to
si
ensure a safe
si
and
loo
sanitary
daboolo
environment
baahida
for
ilmaha
diaper changes.
gaarka ah isla markiina
The
si
updated rule
gaar loo
allows for
xiro
the use of swap
shuruudaha
or reusable
goobta lagu
diapers in
bedelo
family childcare
xaafiyada
settings.
xafaayada
However, these must be
waa
stored and
waa la
cleaned
waa
according
la
to
cadeeya
specific
waa la
requirements to
cadeeyey
prevent contamination
waxaa la
and
ogol
ensure
yahay in la
hygiene.
isticmaalo xafaayado
A
dhar
disinfecting
ah ama
solution must be
dib loo
available at
adeegsan
each
karo
diaper changing
iyadoo lagu
station
xiro
or area
iyadoo lagu
and
xiran
kept
yahay
ready for
shuruudaha
immediate
gaar
use. The
ah oo ku
disinfectant must
saabsan
be stored
kaydinta
out
iyo
of reach
nadiifinta
of children to
halka
avoid any accidents or misuse.
dilka waa in lagu
These
hayo
updates
meel
are
kasta
designed to
oo lagu
enhance the
iibiyo
cleanliness and
xafaayada
safety of the
diyaar u
diapering
ah
process,
in
helping
si
to prevent
ah
potential health risks
loo
like skin
isticmaalo
infections
lagana
or
ilaaliyo in
contamination.
carruurta gaaraan.
And now, before we move on to our next section, I'm going to take a moment to check in to see if there are any questions that need to be addressed. Ronnie, do we have any questions?
fursad ina su'aal weydiisiin.
Yes, we do, Cynthia. Thank you for giving this opportunity. So there's a question about baby walkers and bouncers. Can they be used in the childcare programs?
Hi, thanks, Ronnie. Thanks for the question. Baby walkers in particular cannot be used for childcare children, but bouncers like a seat can be used, but there are restrictions on the amount of time that children can be in that equipment.
Thank you, Abby.
Mhm.
Do we have a list of approved disinfectants and sanitizers that should be used?
Their sanitizer is actually defined in rule, and we really rely upon it, and it actually I think does say like what it needs to be, whether you're using diluted bleach or whether you are using an actual some sort of other disinfectant or sanitizer. I believe in the definition it speaks to what those need to be and what the labels need to say on them. You can test the, you can use like bleach test strips to test the diluted bleach. And there are like recommended levels of bleach for a sanitizing solution and a disinfecting solution.
Thank you, Abby. Cynthia, we have the last question is, when we say that an item has to be out of reach, does that mean that the cleaning solution for the diaper changing area, does that have to be locked up or can that be out of reach?
It can just be out of reach. That is part of the new definition of inaccessible to children, includes items just being out of reach of children. And there are there's more information on the definition. That could also be stored behind a secured baby gate, but for the purposes of like a disinfectant and a diaper changing station, it could just be stored on a high shelf, assuming that children can't reach that high shelf.
Thank you, Abby. We have a few more that came, but we don't have any more time, and we'll go ahead and try to respond to those in the Q&A. Thank you.
Thank you, Ronnie and Abby. And now I'm going to hand it right back over to Jackie, and she's going to go over some changes to behavior and guidance. Jackie?
Hadda Jackie waxay noo dulmari doontaa
Thank you,
hadalay ku
Cynthia.
yimaadeen dabeecadda
Okay,
hagid
so we're going to now
shuruudaha
review
dheeraad
an
ah oo
important
loo
update
xoojiyay ayaa
regarding
lagu
behavior
daray
and guidance
siyaasadda la
policies
xiriirta
in family
dabeecadda
childcare settings.
iyo hagidda.
These changes emphasize positive guidance and ensuring fair treatment for all children.
Waxaa la rabaa
You must use
in
positive
ciyaalka
guidance
inaysan
techniques to
inaysan
help
dareemin
children develop self-regulation,
cunno
self-direction, and
bixiyuhu
respect for
ma
others.
isgaarsiin
You must also
daryeelada
actively intervene to stop the
yaa
unfair
ku shaqeeya
treatment of
ganacsiga
children
adigaba
based on their
oo
family,
yiraahdo bixiyuhu
gender,
waa
race,
inuu
ethnicity,
habboon
economic
u
status,
farageliyo si
ability,
loo
religion,
joojiyo daryeelka
or cultural
xorriyadda ah
background.
ee la muujiyo
These updates
loo
reinforce the
muujiyo ilmo
importance of
iyadoo
creating
lagu
a
saleeyo
nurturing,
iyadoo
respectful,
lagu
and
saleynayo
equitable
qoyska,
environment for
ilmaha,
all children.
jinsiga, qowmiyadda ama midabkii,
Next, let's
dhaqanka,
go
diin,
over some important
kartida,
updates regarding prohibited
naafiga.
discipline
Taan waxa la
and actions
xiriirsan hadduu
in family
naafiya
child care settings.
heerka dhaqaalaha,
These
deeqda,
actions are
tababarka,
now more clearly defined to
tiriyo,
ensure that all
asalka
discipline
dhaqanka ama
methods are
hidahooda.
safe, respectful, and developmentally appropriate. The new rules explicitly prohibit certain actions that are harmful or inappropriate for children. And these include using food or foreign objects in a
Anshax
child's
marinta
mouth
iyo
as a form of
ficilada
discipline,
mamnuuca ah
exposing children to extreme
waxaa la daray
temperatures, whether hot or cold,
oo la
as a form of
cadeeyey in
punishment,
ficiladan iyo anshax
humiliation,
marinta
or
la
name calling,
mamnuucay in
including the
cunto
use
ama
of derogatory or
wax walba
sarcastic
qalaad
remarks
lagu rido
that could damage
xagga
a
ilmaha,
child's self-esteem.
in ilmuhu la kulmo
Excessive physical exercise as a punishment, which could be
kulul
harmful
aad u daran,
or
meel
unsafe
ama
for
wax
children.
qabow xad dhaaf ah,
Requiring the
qaybeen
child to remain silent or
ugu yeerin
inactive for
magacyo
extended
dhaawac leh
periods,
ama
which is
hadala iyo sid
inappropriate
ama
for their
kaftan
development. And
jimicsi
removal from
xad
all
dhaaf ah
activities
oo lagu
as a
ciqaabo
disciplinary
ciyaalka,
action,
in
which can
ilmuhu
lead
lagu
to
qasbo
isolation
inuu
and
aamuso
emotional
ama
distress.
aanu dhaqaaqin,
These
in laga
actions are
saaro
prohibited
dhammaan
because they could
howlaha
cause
la
physical harm,
wadaagayo
emotional
carruurta.
distress, or hinder
Waxaan
a
oo dhan
child's
waa mamnuuc.
development. Instead, you are encouraged to use positive discipline strategies that focus on teaching, guiding, and helping children
Waxaa la
understand
rabaa inaad
appropriate
ciyaalka
behavior.
la miciishid
By following these
haddii aad
updated
dhaqankooda
guidelines,
inaan wax xun
we create
suubiyaan,
a supportive
inaadan
environment where children
wax
feel
jidkooda
respected and
ama
valued.
maskaxdooda dhaawac gaarinaynin, inaad u
Next, let's discuss the
hadal
updated physical
sida aad uga
restraint
hadli
policy
kartiin,
for family providers.
aadna isbeddel keeni
These
kartiin.
changes emphasize safety, appropriate use, and documentation when restraint is necessary. It is important that providers read through the rules regarding physical restraint. The new rules include when physical restraint may be used,
Xakamaynta jirka,
rules around
xeerar
physical
cusub
restraint,
ayaa lagu daray kuwaas
when
oo
to
jiraan
discontinue the use of
qeexidda
physical restraint,
waxaa lagu tilmaamo
what needs to happen
xakamaynta
if physical restraint is
xaalad
used, which
xaaladuhu
includes
lagu
reporting and
xaaladaha
documenting,
lagu ogol yahay
and
in
finally,
la
rules around if physical
xakamaynta jirka,
restraint is used
shuruudaha
more
la
than
xiriira
once on a
diiwaangelinta
specific
iyo
child.
warbixinta marka la
These
adeegsado
changes ensure that
xakamaynta
physical
jirka.
restraint is only used as a last resort, is done safely, and is monitored for appropriate use.
Waxaan
So before we
laga
move on to our next section, I'm going to take a moment and check back in and see if we have
qodobkan
any
ku
questions
gudbin,
that may
waxaan
need to be
rabaa
addressed.
Dignity inaad su'aal
Any questions, Ronnie?
Thank you, Jackie. We don't have any right now.
Thank you.
su'aal waqtigan
Thank you. I appreciate that. All right, so then now I will turn this back over to Jenny.
Thank you, Jackie. Next, let's discuss updates to exit requirements for family childcare homes, which ensure safe evacuation routes in the case of emergencies. Every floor used for childcare must have two exits. One exit per floor must be a door leading directly outside to ground level. The second exit may be either
qaab dhismeedka guriga
another direct
badbaadada
door to the outside
ama nabadgelyada
or an
ilaalinteeda.
operable window
Waxaa la
that
cusboonaysiiyey
includes
shuruudaha
opening
ka
overnight.
bixisa shuruudaha
These updated
exit
rules
ama
ensure
exitka
that
qaabka
all
guriga laga
children and
baxayo
caregivers
ee
have
xarumaha
safe,
ruqsada
accessible, and quick
ruqsadaha leh
evacuation
ama
routes in the event of a
diiwaanada la
fire or an
bedelayo,
emergency.
kuwaas oo ay ka mid
The
yihiin
rules also
tirada
provide requirements
albaabada laga
around
bixi karo,
portable electric
albaabada
exit
ama jidadka
indoor
toos uga hayo
locks,
dhulka
and window
dhulka
panels.
hoose,
These
albaab
updates
kale
enforce
oo
emergency
dheeraad ah, the
preparedness,
second exit,
safe
sida
heating
loo
practices,
sida
and
loo
child
qeexayo
safety within
albaabadaha laga
regulated
bixi
managed
karo.
childcare settings.
Waxaa sidoo kale lagu daray shuruudaha cusub oo la
Now let's
xiriira
discuss the
isticmaalka
updated rules for preventing
kululeeyaasha
and
korontada
exposure
ah ama
to
space
toxic
heaterska,
substances
xadadka
and required barriers
naahyada
in
la
bodies
jiido,
of water.
lofts ama goobo
The
kor u
updated
kacay,
rules
iyo heerkuleelka gudaha guriga.
Sanitizing and disinfecting solutions must be inaccessible to children. Additional examples of hazards include lead-based paint, plumbing or fixtures with lead, asbestos, and toxic mold. These substitutes are
Kahortagga iyo maareynta halista.
childcare
Halista waa in aanan carruurta heli karin, aanay u suurtagal ahayn inay heli karaan. Waxaana caddeeyay inay xalalka u nadiifiyo ama jeermis dilo lagu keydiyo meel aanay carruurta gaari karin. Heerarku waxay bixiyaan tusaalooyin dheeraada. Sunnooyin dheeraad ah ayaa lagu daray xarumaha laga rabo inay ka hortagaan, sida rinji salkiisu yahay lead-based paint, tuubooyinka iyo qalabka biyaha oo leh lead, asbestos, caariyada sunta ah, toxic mold.
Such as glue guns, irons, and other similar items when working with preschool and school-aged children. The rule allows for the use of tools like glue guns, irons, and other
Alaabta
tools.
guriga, qalabka iyo agabka ciyaarta waxaa la ogol yahay in la isticmaalo qalab halis badbaadada sida bastooladaha, koolada, biiraha kululeeya iyo waxyaalaha caynka ah. Marka la siiyo carruurta da'da xanaanada iyo kuwii dugsiyada dhigta, iyadoo la bixinayo tilmaamo gaar ah iyo kormeer joogto ah.
By following these guidelines, you can help children safely engage in creative or learning activities that involve tools while minimizing the risk of injury.
Haddaad nidaamkan raacdi, waxay suurtagelinaysaa in adeegyada ciyaalka inay maskaxdooda ka shaqaysiiyaan, ay adeegsadaan agabyadan, laakiin nabadgelyadooda ilaalisa. Hadda waxaan dulmaraynaa isbedelada ay ku yimaadeen qaabka ay banaanka ku dheelayaan ciyaalka.
Except for rebound, which are smaller individual trampolines that are
Goobta
safe for
ciyaarta
one child
dibadda,
to use at
carruurta daryeelka la siiyo looma ogola inay isticmaalaan trampolines marka laga reebo kuwii boodka yar ama rebounderska kuwii la yiraahdo. Qalabka ciyaarta ee dhererkoodu ka badan yahay 18 inches looma ogola in laga isticmaalo meelaha siman ee adag sida laamiga ama dhagxaadda kale ee adag. Waxaa lagu dhiirigelinayaa in ilmaha uu xirto koofiyad badbaado ah ama helmet markuu uu adeegsanayo baaskiil ama bisikleti, baaskiilka saddexda lug leh ama tricycle, baaskiilka dheelitiran ama balance bike, scooter, skateboard ama skateska isbedelka the inline.
Rules now include updated exclusion guidelines based on specific symptoms, and these guidelines have been aligned with the recommendations from the Oregon Health Authority and the Oregon Department of Education. If a nappy pin is used on a child, CCLD must be notified by 5 p.m. of the next business day.
Cudurada ama jiritaanka bedel qaabka adan la maciili lahayd. Tilmaamaha ka saarista ilmaha ee ku salaysan calaamadaha gaar ah ayaa lagu daray si ay ula jaanqaadin hagidda ka saarista ee hay-adda caafimaadka Oregon iyo waaxda waxbarashada Oregon. Waa in si dadaal lagu wargeliyo ugu dambeyn 5 galabnimo maalinta shaqo ku xigto haddii la isticmaalo qalabka amniga.
Must be documented with a report. The report must include the signature of the parent indicating that they reviewed the report or received a copy within 48 hours of the incident or injury occurring, and should be maintained in the child's file. An email or text confirming receipt will count as a parent signature. The updated rules now include a dislocated bone as part of the serious injury category. If a child experiences a dislocation, it must be documented and
waxaa lagu
reported
daray
to the
tilmaamo ka saarista ilmaha ee ku salaysan calaamadaha
have
gaarka
some
ah
important
si ay
additions. The
ula
first
jaan qaadaan xeerarka ka saarista.
These additions include sling or triangle bandage, bottled water for cleaning wounds or eyes, tweezers, plastic bags, and cold. These additions ensure that your first aid kit is fully stocked to handle a broader range of injuries and incidences in the childcare setting. By ensuring these
Dhaawacyada
reporting requirements
um,
and first
ama
aid supplies
injurieska
are in place,
warbixin
children
kasta oo ku
prepared to
saabsan
handle
dhaawac
any
culus
emergency that may
ama
arise
dhacdo halis
and
ah
provide
waa in laga
updated
hayo
and
fayl,
follow-up
waxaana
for
ku
children
jirta
in need.
saxiixo waalidka oo muujinaya inuu dib u eegay ama nuqul
Now let's talk about
nuqul
some
ka
important
helay
updates regarding
48
medication
saacadood
safety
gudahood marka uu
and the
dhaawaca
administration of
ama
non-medical items
dhacdadu
in the childcare
dhaceen.
setting.
Laf kala baxay
Children with
ayaa lagu
chronic
daray
medical
liiska
conditions
waxaa loo aqoonsada
districts
dhaawac
should
culus.
now receive up to 12 months of permission to administer medication related to their condition. You can now get over-the-phone permission from parents to administer a single dose
Hadda
of
waxaan ka hadlaynaa
non-medication.
daawooyinka.
The permission should be documented and include who received permission from, what time, and what medication was given. All medication must be stored under child safety law to ensure that it's inaccessible to children.
Hadda waxaa lagu ogolyahay in hal mar
Medication
waalidka
such as
ogolaansho ka
aspirin
heshiis
or
sanad walba ama labadii toban
be
bilood
inaccessible to
inaad
children
daawadan
or review to
gaarsiisid
ensure that
gurigooda.
it's readily available
Waxaa lagaa rabaa
and
inaad
maintained out of children's reach. You
inaad
now have
meel
the option to receive
wanaagsan aad ku keyditid
authorization
daawada.
from parents for the use of non-medical items like sunscreen. For these non-medical items, you no longer need to document the application of sunscreen or diaper cream, making the process more streamlined. The rule previously prohibited the use of aerosol sunscreen has now been removed. But remember, sunscreen must always be applied according to the manufacturer's instructions. Finally, it's important to note that medication cannot be administered after its expiration date. These changes are meant to make medication management and the administration of non-medical items easier while ensuring the safety and well-being of the children in care. Now let's discuss the updated rules around written care plans for children who have or have increased risk for chronic physical, development, behavioral, or emotional conditions. If a child requires additional supportive services that go beyond what's typically needed for a child, a written care plan must be developed and kept on file. This care plan should outline any specific services or accommodations that the child needs to thrive in the childcare setting. If the individualized service required for the child means that they need to be out of direct supervision of the caregiver, parental permission is required. For example, if a child needs one-on-one therapy sessions or specialized care that takes them out of the general childcare group, you must have written consent from the parent or guardian before proceeding. The written care plan ensures that you are prepared to provide the right level of care and help to ensure the child's safety and well-being while in the care. This is essential in providing individualized, appropriate care for children with specific needs. Before we move to our next session, I'm going to take a moment to check in and see if we have any questions that need to be addressed. Ronnie, do we have any questions?
Thank you for giving this time, Jenny, but we don't have any questions at this time.
Ronnie, I think we did want to, there are no questions, but we just have some, wanted to clarify something about the use of bouncers for infants, and that the use of, oh, maybe Christina can help me with it, the wall or the help, I don't remember, what are they called, Christina?
The
Johnny
ones that are
jumper.
used in a doorway, walkway
Doorway.
entry, like they're the I don't know the actual term, but they hang in the doorway and kids can jump Johnny jumpers or
We
something.
call them Johnny jumper.
Yeah, those aren't approved.
Those aren't approved. We just wanted to make sure that folks knew the distinction between like a bouncer that sits on the floor versus the door hanging equipment. Thanks, Ronnie.
Good job. Okay, that'll be it, Jenny.
Thank you, Ronnie. Thanks, Abby. And now I'm going to turn it back to Cynthia to go over the final areas we will be discussing this evening.
Thank you, Jenny. All right. So now let's go over some updated rules around food safety, the beverages that can be served, and new choking hazard guidelines. Children are not allowed in the kitchen or food preparation areas while food is being prepared, unless you are present to ensure the children's safety. You must also protect children from hazards such as hot foods, sharp utensils, or anything that could pose a risk. There's a new provision allowing for parents to opt out of milk service. However, this cannot be a program-wide policy. It must be done at the parent's request. If a parent does not want milk served to their child, you must accommodate the request, ensuring alternatives are provided. You are now required to serve only the following beverages: water, milk or nutritionally equivalent milk substitute, and 100% fruit or vegetable juice. These options ensure that children receive nutritious beverages that support their health and well-being. There is now a list of choking hazards that cannot be served to children. It's important to be aware of which foods may pose a risk and to avoid serving them to the children in your care to prevent choking incidences. By following these updated guidelines, you can ensure that your childcare setting remains safe, health conscious, and accommodating to parents' requests, while also minimizing risks like choking. Next, we'll review the updated rules regarding field trips and transportation safety. When taking children on a field trip, you must frequently check a written list of children on the field trip, ensuring that all children are accounted for. This check must occur before boarding and exiting the vehicle, anytime the group changes locations on the field trip, for example, moving from one exhibit to the next. This will help ensure that no child is left behind and the group is always properly supervised. When there are 6 or more children on a field trip, each child must wear an easily identifiable item, such as a label, shirt, or wristband displaying your name and telephone number so that the child can be identified if needed. Additionally, you must be easily identifiable as well to ensure others know who is supervising the children. Next, we'll review the updated rules regarding field trips and transportation safety. There are new transportation safety practices that must be followed, including specific information and items that must be maintained both at the program and in the vehicle. This helps ensure that transportation is safe and well documented. A notice of a field trip must be posted at least 48 hours in advance and must include the date, destination, and estimated time of departure and return. The notice must be placed in a prominent area where parents and others can easily view it. A parent may be allowed to transport children and other than their own without a caregiver present in the vehicle, but the parent must meet certain substitute provider qualifications and transportation requirements as outlined in the rules. The parent must also be enrolled in the CBR. These updates ensure that children are safe and accounted for during field trips and that transportation is well organized and properly communicated to both staff and parents. Now, let's go over the updated rules regarding water activities and swimming safety. For children engaging in activities in natural bodies of water, such as shallow surf, lakes, rivers, and streams, the activity is now limited to wading only. Swimming is not permitted in these environments. Additionally, children under the age of 36 months are prohibited from wading or swimming in natural bodies of water to ensure their safety in potentially hazardous environments. There are new requirements for pools used in childcare settings. These updated guidelines are designed to enhance safety and to ensure pool use for childcare meets specific criteria to minimize risk to children. The caregiver to child ratio for swimming has also been updated to ensure appropriate supervision during swimming activities. By following these updated rules, you can ensure that children are safe during water activities while they're in natural bodies of water or in pools. Now, let's address a new rule regarding animal contact. You must ensure that any animal accessible to childcare children is healthy with no signs of disease, friendly and non-aggressive towards children, free of fleas, ticks, and worms, fully immunized, including rabies vaccinations for dogs with proof of vaccination on file, and kept in a cage or tank, except for cats and dogs. Providers must take precautions when encountering unfamiliar animals or strays to ensure children's safety. Now let's go over the important updates related specifically to providing night care. These changes were made to ensure that children receive safe, supervised, and developmentally appropriate care during nighttime hours. First, let's talk about supervision and safety. Providers are now required to be on the same floor level as sleeping children. This is to ensure that they can respond quickly and appropriately if children need assistance during the night. Additionally, any guest or individual aged 18 or older who is sleeping in the home while care is being provided must be enrolled in the Central Background Registry. Next, let's review sleeping arrangements and hygiene. Children who are in full-time night care must have their own bed and mattress, and that mattress must include a waterproof cover. For all children except infants, providers must supply sheets, pillows, and blankets to support a comfortable and developmentally appropriate sleep environment. To maintain hygiene, bedding must be washed at least once a week, anytime it becomes soiled, and before the use of by another child. Let's continue exploring the key rules around night care. When it comes to bathing and personal care, there are new requirements if providers offer bathing. The home must have a bathtub or shower with non-slip surfaces to prevent accidents. Each child must also be given their own washcloth and towel. For school-age children, privacy during bathing must be respected and aligned with their developmental needs. In addition, children must have the opportunity to brush their teeth before bed using an individual toothbrush and toothpaste, which supports both health and routine. Nutrition is also an important part of nighttime care. All meals and snacks must meet established nutritional guidelines. If a child hasn't eaten before arriving, dinner must be provided to ensure they don't go to bed hungry. Even after dinner, children should be offered a nutritious snack before bedtime. And if a child is still present in the morning, breakfast must be served unless the parent has specifically opted out. These guidelines help support the health and well-being of children by promoting consistent, balanced nutrition during nighttime care. And that brings us to the end of today's webinar on the Registered Family Child Care Rule Revision. Thank you all so much for taking the time to join us and for your continued dedication to providing safe, nurturing, and high-quality care for children and families across Oregon. Your role is incredibly important, and we appreciate the work that you do every day to support early learning and development. As you begin to implement these updated rules, we want to remind you that you're not alone. For additional information, tools, and training and resources, please visit our website at www.oregon./DELC. It's a great place to find the most up-to-date guidance and support materials related to rule revisions. And of course, if you have any specific questions or concerns on how these changes to your program, please reach out to your licensor directly. They are there to support you and to help you navigate the changes and adjustments you may need to make. And again, but before we close out for the final time tonight, I wanted to check in to see if there are any last-minute questions that are looming. Ronnie?
Thank you, Cynthia, for the time. Abby, I'm wondering if you can talk again about how people can find the recording at the end. Just remind them again, please.
Sure. The recordings for this webinar will be up on the DELC YouTube channel, but we will also put links up on the DELC website for so that you can just go to the DELC website and then just click on it and it'll take you to the YouTube channel. I did also, because there was a couple of questions about this, on the DELC website in our provider resources, there is actually a summary document that lists all the rule changes, and you can find that on the DELC website. Somebody asked where we could find all the new the rule changes. You can also reach out to your licensing specialist and they can either email you a copy directly or get you a hard copy for your next visit or mail it out to you. So, and that's a really good resource because it will highlight a lot of the things that we just highlighted today.
Great. Thank you both. So once again, thank you all for your time, attention, and commitment. Together, we're creating a safer and supportive environment for children in every corner of our state. I really do hope you all have a great evening, and we look forward to connecting with you all again soon.